From stories across the globe to stories here at home, this is the National News Broadcast. A very good evening to you. I'm Sharifa Tahir.
And I am Tilina Udayaratna. We begin with a quick check on tonight's top stories. State Minister Lalith Gavana says that the statement made by the mill owners on the prices of rice is unacceptable. The Cabinet grants approval to import 100,000 metric tons of rice. Daily COVID-19 infections in the country drop below the 1,000 mark after 83 days. New guidelines for local and foreign air travellers. UK's fuel crisis threatens many services and industries in the country as the army is on standby for distribution purposes.
We move on to those and other stories in detail now. Cabinet Ministers decided to import 100,000 metric tons of rice to maintain a buffer stock under the government custody. It was revealed at the Cabinet briefing held today that the relevant decision was reached in order to avoid a rice shortage in the market. Meanwhile, the Cabinet of Ministers has also decided to cancel the present maximum control prices of rice with immediate effect. Minister Lalith Gavana said that one of the decisions taken with regard to rice shortage is the decision to cancel the Gazette notification on the control price rates on rice. He also said that a decision was reached to import 100,000 metric tons of rice as a buffer stock through the Ministry of Trade.
අවශ්‍ය අවසරය ලබා දුන්නා වෙළඳ ඇමති තුමාට සහ අමාත්‍යාංශයට.
ඒ තීන්දුව අනුව වෙළඳපළට
State
අවශ්‍ය
Minister
කරන
Lalith Gavana said that the decision to import 100,000 metric tons of rice was initiated by the Ministry of Trade today. He said that the President stipulated a certified price rate for paddy and the government was able to strengthen the income of farmers in the year 2020. He said that the government, in resolving issues pertaining to farmers, was not able to import rice into the country in 2020 after many decades. However, he said that this year the government had to resort to such decision considering the helplessness of the consumers. He further said that the farmers should not inflict fear over the decision as the government is prepared to purchase paddy through Paddy Marketing Board to a certified rate than the mill owners. He said that the monthly consumption of rice in the country is at 200,000 metric tons. Therefore, he added that the decision was reached only to import 100,000 metric tons of rice and distribute through Lanka Tourism outlets as well as cooperative establishments. The State Minister said that maintaining a certified price rate in an open market for a longer period is problematic. Therefore, it is imperative to face various changes in an open market social system. He said that the government has to interfere based on the abnormal process which occur within a market due to corrupt and unfair trading activities by certain entities. Accordingly, he said that the government has to make certain decisions to safeguard the consumers. He said that there is a shortage of commodities at present. He also said that close to 800 containers are currently at the port due to the concerns related to dollars. He said that a cabinet of ministers allocated $50 million to make arrangements to expedite the process to release containers from the port. Minister Lalith Gavana said that the present government has not sold any of the resources in the country. He said that the government represents all industries and sectors in the country in accordance with the Vistas of Prosperity policy statement. He said that investments as well as partner investments should also be discussed. He reiterated that the government are currently engaged in short and long-term investments in the country and not planning to sell the resources of the state.
State Minister Lalith Gavana says that he does not agree with the statement made by the mill owners over the decision regarding the price rates of rice. The State Minister made these remarks in response to the statements made by the mill owners over the price rates of rice based on the decision reached by the Cabinet of Ministers to cancel the relevant Gazette notification on controlled prices of rice. State Minister Lalith Gavana said that the decision to revoke the relevant Gazette notification was released by the government and the Cabinet of Ministers in order to safeguard the consumers as well as farmers. If an entity attempts to use this freedom in an unfair manner, then the government and the Consumer Affairs Authority will officially mediate to protect the consumer. Accordingly, the price rates presented by the rice mill owners are not justifiable. Therefore, he added that the Ministry of Trade has taken measures to import 100,000 metric tons of rice to the country. The state minister said that the government will take measures to provide rice at fair price rates, and further measures will be taken to provide rice produced locally to the public at fair prices.
Daily COVID-19 infections in the country has dropped below 1,000 mark after 83 days. Accordingly, 938 COVID-19 infected persons were identified yesterday. More than 1,000 COVID-19 patients were identified in the country since July 7th until September 26th. The most number of patients were identified on the 29th of August with a total of 4,612. The number of infections reported yesterday was below 1,000. Accordingly, the epidemiology has indicated that a total of 938 COVID-19 infected persons were identified in the country yesterday. A total of 642 COVID-19 patients were identified from the country today. Accordingly, the number of active cases in the country has increased up to 46,361. A total of 743 recoveries were reported today, increasing the total recoveries to 456,087. The Director General of Health Services confirmed 55 COVID-19 related deaths which reported yesterday. Meanwhile, co-cabinet spokesman Minister Ramesh Pathirana said that the decision to reopen the country on the 1st of October will be announced following the meeting of the task force for prevention of COVID-19 in the next 2 days. He said that a final decision is yet to be taken on the resumption of the state sector. Meanwhile, State Minister Meanwhile, State Minister P.R. Nishant said that schools will be reopened under 4 stages in future. Prime Minister Mahinda Rajapaksa received the Suvadarani Ayurvedic medicinal herbal drink today, which is expected to be distributed among the public free of charge to safeguard them from COVID-19 outbreak. The relevant event was held at the Temple Trees, and the herbal drink was presented to the Prime Minister by State Minister Sisira Jayakodi. The herbal drink will be distributed through all religious establishments in the country under the first phase and through divisional secretariats under the second phase free of charge. Secretary to the Prime Minister Gamini Senarath and Chief of Staff to the Prime Minister Yoshitha Rajapaksa were present at this occasion. The vaccination of children between the ages of 12 and 19 with special needs and other health complications was initiated yesterday, covering Western Province under the COVID-19 immunization program. The relevant program will be initiated in other provinces from the 1st of October. Another vaccination program for children between the ages of 12 and 19 with special needs and other health complications commenced at the Gampaha District Hospital today. A vaccination program for children between the ages of 12 and 19 with special needs and other health complications was initiated in Kurunegala district today. Another vaccination program was initiated for children between the ages of 12 and 19 with special needs and other health complications at Avisawala District Hospital yesterday. A total of 26,096,107 vaccine doses have been inoculated under the COVID-19 immunization program thus far. A total of 14,433,611 persons have received the first dose of the vaccine, while 11,662,496 have received both doses thus far.
The Ministry of Health says that a new guideline for local and foreign travellers arriving from flights will come to effect from midnight today. Minister Keheliya Ramukwala said that it is essential to reopen the country gradually within certain limitations. These remarks were made during a meeting held at the Health Ministry today. The relevant meeting was scheduled as per a request made by Minister Prasanna Ranatunga, and representatives from various organizations related to the tourism industry were also present at this meeting. A decision was reached at the discussion to release fully vaccinated local and foreign travellers arriving from abroad from the 1st of October without conducting a PCR test at the airport if they are tested negative for COVID-19 from the PCR test performed prior to their arrival from the respective country. The decision was reached in accordance with the instructions of the technical committee. Foreigners and tourists who have not been fully vaccinated will have the opportunity to travel to their respective hotels in a bio-bubble. Director General of Health Services Dr. Asela Gunawardena said that a PCR test will be carried out upon their arrival to the hotel. However, Sri Lankans will be released to return to their homes if they are tested negative for COVID-19 from the PCR test performed at the airport or hotel. Such persons are subject to undergo another PCR test on the 12th day following their return to the country and have the opportunity to be placed in society if they are tested negative for COVID-19. Those who do not have the required facilities for home quarantine will be directed to a 14-day quarantine at a government centre or a hotel of their choice. Those who arrive in the country from flights will be subject to a PCR test within a period of 72 hours. Minister Kelia Ramukwala said that public safety is more important to other factors and complete attention should be directed for the safety of the citizens as well as the health system. Specialist physicians made remarks over the COVID-19 immunization program currently underway for children and pregnant mothers during a media briefing held today. They pointed out that the importance in reopening schools across the country to avoid conditions such as psychological impairment is of paramount importance.
The vaccination campaign regarding the COVID-19 started with a circular on 31st of May and it has now evolved, and most of the provinces and districts have vaccinated their pregnant mothers. The percentage of vaccination is highest in Gampaha district, and the Gampaha district is now enjoying the benefits of such. So there is no seriously ill pregnant patients who have completed their vaccination in hospitals in Gampaha district. Our emphasis is for the government to analyze the effectivity of the pregnancy related vaccination campaign very quickly and take very urgent necessary action, summoning the chiefs who should address these vaccination campaigns and quickly rectify whatever the deficiencies they experience or the support they need to be provided in order to have it 100% vaccination within very short period of time in this month.
On 24th of September, we started immunization of children against COVID-19. Especially, we selected children with comorbidities. What I meant was children who have special problems related to lungs, heart, kidney, bowel, etc. And also we give vaccine to children with thalassemia and diabetes. So it's very important for parents to seek treatment, actually getting the vaccine. It will be done under the supervision of medical officers, and prior to giving the vaccine, consultant has to give the recommendation. After the vaccine, we have a mechanism to surveillance for side effects. This is very important, and we are going to vaccinate children in other districts on 1st of October. This is a special day. We commemorate Children's Day on this day. Children would be benefited. We want to safeguard rights of the children. We want to safeguard the children's health and make sure they are safer in this type of a pandemic. So I think that is the best thing we can give to the parents on such a day, and I hope all the parents would try to get maximum benefit from this program. Opening of the schools and vaccination of the children are two entities, but I think other thing we have to pay attention is the problems children are faced with when they are at home, especially psychosocial issues. So it is very important to open the schools. Currently we have vaccinated most of the school teachers and then the ancillary staff, and I hope most of the people who provide transport and other support services are being also vaccinated. So when they move to the school, they are in a much more safer environment comparing with 6-7 months ago. We must have a proper plan because not only opening the schools, after opening schools also, how we sustain this opening and support the children. Sri Lanka College of Pediatricians have taken a decision and we have divided consultant pediatricians to all the zonal areas when the schools open. If children have some problem, easily the principals or the teachers can contact relevant consultant pediatrician and seek opinion.
Deputy Director General of Health Services Dr. Hemantha Herath says that no complaint have been received over the PCR laboratory established at the Bandaranayake International Airport in Katunayake. He dismissed the reports which have indicated that the laboratory produced PCR reports using an incorrect methodology as baseless.
With regards to the PCR laboratory newly established at the Katunayake Airport, I wish to emphasize that this has been officially declared open and at present the services are being provided. However, we have been informed that from time to time small adjustments need to be made. That is what I meant yesterday by telling that it's still they are doing in a way the test runs, but the activities are carried out as per the required standards. However, you all have now pointed out that there had been incidents where the test results have been released beyond the guidelines or something, but so far the Ministry of Health has not received any complaints or information as such, because we inquired that, and therefore we want to emphasize the fact that at the moment there is we inquired and we have not found any irregular or something against the guideline is happening. However, if you have any details, please let us know so that we can draw the attention of the required authorities to correct any of the deficiencies, if at all, if there is anything that need to be rectified. We will be monitoring the situation and we will ensure that there will be safe arrival of passengers and released into the community without any adverse problems, for which the Health Ministry has a airport health office working closely with the airport authorities, and we are working very closely with the airport authorities, and we will not allow any of these happenings is going to happen, and we will ensure that there will be no such things happening in this process.
Minister Professor G.L. Peiris and British Minister of State for South Asia, United Nations and the Commonwealth, Lord Ahmed of Wimbledon, had discussions at the Sri Lanka mission in New York recently. The ministers discussed a wide range of issues including trade, investment opportunities available in the port city and elsewhere, resumption of tourism and the development and reconciliation processes, with a particular reference to relations with the diaspora. Minister Peiris briefed Lord Ahmed in detail on the substantial progress on the ground in a variety of sectors by domestic institutions despite constraints imposed by the COVID-19 pandemic. During the meeting, Lord Ahmed accepted the invitation by Minister Peiris to visit Sri Lanka at his early convenience.
In the meantime, Sri Lankan Ambassador-designate to Russia, Professor Janitha Liyanage, called on Prime Minister Mahinda Rajapaksa at the Temple Trees today before leaving to Russia. Recalling the historic Sri Lanka-Russia friendship, the Prime Minister congratulated Professor Janitha Liyanage on her commitment to further develop bilateral relations between the two countries. Prior to this appointment, Senior Professor Janitha Liyanage served as the founding Vice-Chancellor of the Gampa Wickramarajah University of Indigenous Medicine. Professor Liyanage, a distinguished alumnus of Southlands College, Galle, also served as the Vice-Chairman of the University Grants Commission. Secretary to the Prime Minister Gamini Senarath and Chief of Staff to the Prime Minister Yoshitha Rajapaksa were also present at this occasion. Two Indian forensic audit firms have said there is no indication that the central bank governor Ajit Nivard Cabral has committed an error in the issuance of bonds and the investment procedure of Employees Provident Fund. The Central Bank of Sri Lanka has said that these indications were mentioned in the forensic audit reports issued by these firms. The Central Bank of Sri Lanka has said that if a forensic audit is needed over the investment of the Employees Provident Fund and Sri Lanka bond issuances, such measures should be carried out by the Auditor General of the country or under the complete supervision. However, without adhering to normal procedure, the relevant forensic audit was handed over to 2 Indian firms under the acknowledgement of the members of the Monetary Board who have been alleged for various corruption charges and the guidance of the officer who has raised other suspicions. The statement issued by the central bank has raised suspicions over the handing over of the forensic audit to 2 controversial audit firms in India for an abnormal fee. The relevant firms have stated that no responsibility will be borne over the forensic reports following submission, which indicate that Sri Lanka would not receive any benefit from these forensic audits. Accordingly, the statement has indicated that an effort had been taken to tarnish the reputation of present Central Bank Governor Ajith Cabral using these reports. The central bank statement has further indicated that certain entities had also taken the effort to divert the attention from those who were involved in the bond scam incident, including former Governor Arjun Mahindran, by making such allegations against Governor Ajith Cabral based on these forensic audit reports.
Minister Dallas Alahaperuma says that summoning a group of journalists to the Criminal Investigation Department over a newspaper report cannot be condoned. Speaking at the cabinet briefing, the minister said that such incidents should not have taken place. Minister Dallas Alahaperuma said that they are deeply regretted by the incident and rejects such moves as a government. The Prime Minister has emphasized that journalists should not be summoned to the Criminal Investigation Department for enquiries. He extended his appreciation to Minister Sarath Weerasekara for being responsible and for stating that the Criminal Investigation Department officers will not visit media institutions for such issues. And in the meantime, Minister Dallas Alahaperuma also says that the Right to Information Act, which has been in effect for the last 5 years, is a positive feature of a developed democratic nation. The minister made these remarks while issuing a statement to commemorate the International Day for Universal Access to Information, which falls today. The minister extended his appreciation for those who committed and are continuing to commit to bring in the act. Concealing information in a technological world where news and information transmit rapidly than a virus is a complete tragedy. Therefore, Minister Dallas Alahaperuma has emphasized on the importance in injecting correct and true information into society in his statement. In other news, the Cabinet of Ministers has granted approval to publish the appropriation bill for the year 2022 in the Gazette notification and table the same in the Parliament. Approval was granted for drafting the appropriation bill at the meeting of the Cabinet of Ministers on the 26th of July. Accordingly, clearance from the Attorney General has been received for the draft bill prepared by the legal draftsman. The relevant resolution to gazette and to table the draft bill in the Parliament was furnished by the Minister of Finance. Cabinet approval was granted to a proposal presented by the Minister of Agriculture to import organic fertilizer for other crops excluding paddy cultivation. Arrangements have been made to import organic fertilizer required for paddy cultivation by government fertilizer companies. Licensed fertilizer companies are responsible to import required organic fertilizer for other crops. Accordingly, approval was granted to import the stocks of organic fertilizer required for other crops by the 2 government fertilizer companies at competitive rates without any delay. The proposal presented by the Minister of Irrigation for the development of 2,000 tanks was granted approval by the Cabinet of Ministers. The relevant program is expected to be completed within a period of 3 years. The development of 5,000 rural reservoirs and tanks have been initiated to strengthen the rural agricultural economy. The Cabinet of Ministers has granted approval to sign an MOU with the Amrita Medical Institution in Kochi, India to perform complex cardiosurgery for children. The relevant agreement will be effective for a period of 2 years, and the intention of this initiative is to reduce the congestion for such surgeries in the country at present. The relevant funding for this initiative will be provided through the International Rotary Club District 3201 and the Rotary Club of Colombo West District 3220. The relevant MOU will be signed between the Rotary Clubs and the Ministry of Health. Cabinet approval was granted for the proposal presented by the President to appoint a trustee board for the maintenance and administrative affairs of the Sandahirusaya Pagoda. The relevant trustee board will be responsible for the administrative and maintenance affairs and to accumulate donations received from local and international devotees following the completion of the pagoda.
In the meantime, Urban Development Authority says the new bird park in Madivela will target city beautification as well as an economic opportunity for residents of the area. The Madivela Wetland Bird Park will be constructed by a local private investor. Director General of Urban Development Authority Prasad Ranavira said that the wetland park in Madivela, which protected the environment, has continued to deplete in the past couple of years. He said that the wetland, which points out by the Madivela Wetland Conservation Organization, is covered with species which are harmful to the environment. Accordingly, the Urban Development Authority prepared a plan in this regard and proceeded ahead with the tender procedure to reach out for investors. Accordingly, a local investor has shown interest in this regard, he added. The DG further said that after checking on his credentials, decision was reached to hand over the relevant tender for this investor. He added that this wetland park will not only target city beautification but economic opportunity for the local residents as well.
The British High Commission in Colombo says medical equipment for the treatment of COVID-19 infected pregnant mothers and infants has been provided to 11 public maternal hospitals across the country. The relevant equipment will be donated to the country in response to a request made by the Ministry of Health through UNICEF. The initiative is funded by the United Kingdom's International Programme Fund and led by the UNICEF. The relevant donation is expected to support the healthcare system of the country by adding medical equipment individually, including high dependency unit beds and multi-para monitors. Receiving the equipment, Minister Kehelia Rambukwala extended his gratitude for the donation. British High Commissioner Sarah Hulton said that this contribution will facilitate the urgently needed life-saving medical equipment and strengthen Sri Lanka's child and maternal health system. Equipment such as high-dependency units in maternity wards have been identified as critical needs. UNICEF representative Christian Scooge said that since the onset of COVID-19, UNICEF has supported the efforts of the Sri Lankan government to ensure that critical health care is provided in the country, especially for the most vulnerable, as a long-standing partner.
The Sri Lanka Tourism Development Authority has launched 2 new online web portals to simplify the travel process for tourists visiting the country. Sri Lanka Tourism Development Authority has indicated that travellers can now pay their PCR tests and travel insurance directly via one web portal and receive their unique tourism reference number required to apply for the visa on the second web portal. Accordingly, payment for PCR tests and travel insurance can be made through a website. Visit srilanka.gov.lk and can apply for visa via eta.gov.lk website.
Well, that's it from the Rupavahini News Desk for tonight. Join us once again tomorrow. Until then, thanks for watching. Stay safe and take care. Good night.
Good night.